We have heard from you that many of you do not have access to a primary health care provider, and we hear that repeatedly. In some cases, there are those who have simply given up looking for one. And we've listened to you, and we've heard your concerns about having access to a timely surgery. We've listened to healthcare providers. We've heard your concerns about the stresses that are very real in your workplace, your concerns about being able to improve the outcomes, the healthcare outcomes for the patients that we serve, which is why we committed to attach each and every resident in this province to a primary healthcare provider. And that isn't the case across Canada today. It certainly isn't the case in Saskatchewan today, but that is the target, and that is where we are heading in this province. But it's also going to help us create that opportunity for people to be able to have access to a primary health care provider, whether it's a nurse practitioner, whether it's a physician assistant. We're going to introduce web-based virtual care to any Saskatchewan resident, focusing on those residents that today are unattached to a primary health care provider. I said earlier, our commitment is to have everyone attached to a primary health care provider, and virtual care is going to allow us to take great strides in that space as we open it up to web-based virtual care across the province, continuing to work with initiatives that are in place like the Dakota Whitecap Virtual Healthcare Hub.
I want to say this very clearly to families and patients. We've heard you, and standing still is no longer an option. And that's why today we have released the Patients First Healthcare Plan. And the plan is grounded in one clear commitment: patients must be at the center of every single decision that we make. Now, this is not a declaration that every challenge in the healthcare system has been solved today or will be solved next week or solved next month, but it is a commitment to accelerate the change that is already underway in our healthcare system. And that's why, as part of this plan, we are taking an all-in approach on the role of nurse practitioners in this province as a central part of improving that access to primary care. Nurse practitioners are trusted professionals with advanced training. They assess, diagnose, treat, prescribe, and manage both routine and complex care. And patients around the province consistently tell us they value the relationship-based care that nurse practitioners offer. Now, over the last year, Saskatchewan has launched the largest publicly funded nurse practitioner primary care expansion in the history of this province. We've introduced a new funding model that allows nurse practitioners to deliver publicly funded care through independent contracts. And as part of this plan, we're announcing that there's no more limit on the number of those contracts around the province. As part of those contracts, we're going to allow nurse practitioners to hire LPNs, RNs, other allied staffs to build out the team-based care that many of our physicians are working in around the province, but we also want nurse practitioners to lead those efforts as well.